So today we have our special guest, Eugene Borukhovich, as well as Mary Jo. First, I'd like to introduce Eugene Borukhovich, who is a serial entrepreneur, executive, venture builder, speaker, and board advisor with a focus in digital health. Eugene is a chairman and founder board member at Your Coach Health. Prior to Your Coach, Eugene served as a global health of digital health at Bayer. He has also co-founded and sold a doctor rating startup and a consultant company. Eugene enjoys running, writing, traveling, and spending time with his family. Moving on to our amazing Mary Jo Potter. She has been an active entrepreneur and investor for 30 years. Having sold a company to McGraw-Hill, she became active in angel investing in Chicago, and upon moving to the Bay Area, she joined Karasu Forum, where she has been a member for 18 years. She has been investing in a variety of entities, but is now focused on the healthcare sector. Mary Jo is now managing partner of Healthcare Angels, a GP in Karasu Capital, an LP in Purple Arch Ventures, which is a Northwestern University venture fund, LP in Portfolio, and a member of Band of Angels and Skydeck. And next, I would love to introduce my partner in crime, Mette, who is founder and CEO of MIME, where she is leading those that suffer from autoimmune disease back to health. Welcome, Mette.
Thank you so much, Michael. And Eugene and Mary Jo, so good to have you here today. I think as I was sort of thinking about how this conversation today would go, I thought it's sort of good we have Mary Jo as a buffer, because I think Eugene and I could go into a rabbit hole here, but without saying too much. But I'm equally excited to have both of you here, and I think from where we're sitting, this is going to be a super exciting conversation, and I really would want it to be a conversation and not so much questions, answers. So please jump in if anyone has something to say in the audience, as well as Mary Jo and Eugene. Please do so. And I was laughing as we were sort of going through the motion of what are we going to be talking about, because I think there's, we are the two M's here, the M&M, and I know that, Eugene, you have a mindset and clear mind M situation going on. So maybe we start there.
Yeah, so I guess the M&M, the first M&M is pretty clear to me now. I just had to do a double take on the screen. So, I think, and by the way, I am going to get caught in this rain now, so I'm walking back a bit. So apologies, but so I think from the 2M's perspective, right? First of all, and I think Michael, thank you for the readout. That was so formal, actually. I didn't expect that. I kind of say I'm either recovering executive or a recovering entrepreneur, right? So I'm now a recovering executive back to entrepreneurship. And I think coming into a big corporate and spending 3.5 years, right? I would ask a simple question around ideation and ideas, because people have ideas, right? Always. The question is there a mindset to execute on those ideas, or just throw them against the wall and see what sticks, right? And so I think, number one to me, so the first M is really the mindset. I also do this podcast, The Shadow of Digital Health Therapy, with another entrepreneur, Jim Joyce. And we had a VC on yesterday, and we were talking about market fit. And he said, you kind of, as an entrepreneur, you kind of start feeling that market fit when the rocket is taken off and those bolts are about to just like shatter away, right? As this rocket is taken off. And both Jim and I kind of said, well, when you have that mindset of exhilaration, when that's happening, that's when you have the right mindset, right? So that's kind of my first M. And please, because I can talk for hours, so feel free to just chime in and over. The second piece is you can't just have a mindset. And I think there's this culture of you got to work, right? And especially as entrepreneurs, there's always more to do and et cetera. I think people forget that you also need to have a clear mind in order to continue with that exhilaration of a mindset. And the only way you can do a clear mind is if you actually take breaks and go back to the balcony, for lack of a better term, right? So Marina, who is the CEO of Your Coach, and my wife and I, right, we are actually on purpose, typically on Fridays, try to shut off starting about 2 p.m., right? And we really try to oblige to that. And we tell the team also, because everybody needs a clear mind to step back. So that's kind of, maybe I'll just pause here for any comments, thoughts, and other things. But those are my two M's.
I think the whole point about stepping back is so crucial, and yet something I think all entrepreneurs struggle with, because our emails and our phones tend to blow up whenever we do it. I actually have a funny story to share, in the sense that on Friday I decided to take this week off. So much of my team was out this week, and I thought, okay, this actually might be a really good shot. And then I know everybody else had these out of office notices, and I thought, let me try that. Just to let you know, I had never done an out of office ever, as in ever. And so I failed at setting it up, and instead I think sent it to everybody who I had an unread email from. So it was a bit of a shit show Friday afternoon, and a lot of people ended up emailing me over the weekend. And I thought it was so funny that instead of actually clearing my inbox, I did the exact opposite. So apparently work still was like pulling me in. But what about you, Mary? Do you have a similar practice that you sort of freak?
Oh, I wish I was that disciplined. I think around the mindset, most of my day is spent meeting with, reviewing, listening to various pitches. And, I'm sure everyone has the same phenomenon. You know fairly quickly if it's in your sweet spot or interest area. And yet we owe it to the entrepreneurs to be as present as possible while they're doing what they're doing. So that's been something I've really had to work on, to be present and to be of help, even if I'm not going to proceed beyond that. So that's probably one. The other one, sort of personally, that I had trouble with, especially early on. You get to like and know these entrepreneurs, and it's so difficult to say no, that I've started a new phenomenon. I only meet with people individually or personally if I know there's a high likelihood that we will be investing. And it's a discipline I've needed to have, because it's so difficult later to say no and to disengage. So I guess those are two learnings.
That's super interesting.
Can I weigh in on this one?
Of course.
Thanks, guys.
Alex, can we say no to you?
Yeah, absolutely.
Of course you can, Eugene.
You guys both said no quite a few times.
Yeah, that's also true.
Okay, so this is from the perspective of somebody who invested in both Mette and Eugene's companies, and faces that same problem that you talked about, Mary. So, we run pitch contests every week, and we only talk to the people, and we talk to everybody, but we only do due diligence at all on people that do well in the contest. So Mette, her company actually won the crowd favorite in a contest. I think it was the end of 2015, right when we first thought of the fund. We said, we're going to run a venture fund crowd challenge. And then we actually opened the fund 14 months later. But anyway, so it's been a struggle for setting it up, because I didn't know anything about it, Mary. But anyway, so we use that as our filter, So our next one is tomorrow morning at 10 a.m. It's called It's Friday Pitches, and it's in the club, MedStarter Healthcare Innovators. So that's our filter, and I totally agree with you, Mary. I mean, the traditional approach is to look at 600 decks and have the associates do all that groundwork. But really, I mean, this is a much more efficient approach. Anyway, man, it's why you get great companies like Mette's and Eugene's wife's.
So I actually want to just comment also on top of that real quick. And Mary, maybe just your first comment around being present with the entrepreneur, even though you already kind of know in the first, whether it's the first slide or first 5 slides or 3 minutes or personality mix. So I was prior going back to this side of it, meaning the entrepreneurship side, I was on the other side of a big pharma company doing, early stage convertible notes and all of that. And to me, actually, being on both sides of this, an entrepreneur, I would actually rather personally, and again, I think everything is personal. I would rather have on the other side an investor say, you know what, just not feeling it. However, I want to be helpful, right? And so let's save the 55 minutes in that hour or 25 and just be straight up. So that's kind of like just my quick comment, because this is the startup struggle discussion, right? So just my 2 cents on that one.
And I'd like to also note that Eugene's the original OG. People think I'm the OG of healthcare, but I actually learned it from him back in 2008.
Yeah, this goes full circle. I think, at the end of the day, I think there's a saying that says if you ask for advice, you'll get funding, and if you ask for funding, you'll get advice.
Yeah.
I think at the end of the day, this all comes down to relationships. And I think, Mary, you found a way that works for you. And I think everybody, even when you have a rule, like I definitely have rules that I break, right? And whenever you break them, you generally find yourself in the position afterwards, you're like, you know what? The rule was in place for a reason. And so I think we all have different ways of sort of navigating life. But I do think that being present in whatever way, form, and shape is probably the most important thing.
Absolutely, and I still do a lot of these like serendipity calls. All the inbound stuff with LinkedIn. I started that a couple of years back, and it's just been a fascinating journey, meeting amazing people around the world, right? And being present, even though it's for those 20 minutes. So lots of great stuff comes out when and I do believe there's science to serendipity.
Totally, and I also think the openness, right? Because I do think sometimes I think my team are like, oh my God, you're way too flexible on how many people you take calls with, when you know that it's just to essentially help them and there's nothing in it for you. But the reality is that I feel like there is a karma place here. I do think we all pay it forward, and sometimes these conversations can actually change the way you view the world, right? And that's when magic happens, as you say.
Can I do a little magic here? This is I just want to note that Mette was quoting Pitbull.
And getting advice. Ask for money. And getting advice.
So you'll be the Christina Aguilera, and can I play Pitbull?
Alex, are we going to have to put you in the audience, bro?
It's usually a good idea.
Apparently, Mary, you and me will need to figure out what we're DJing next year.
Yeah, exactly.
Well, I don't know if Alex even knows this. Just this a funny joke to Alex. In college, I had for about a month a nickname called DJ Huge the Huge. So just FYI, I don't know. Those days are gone.
Let's not unpack that one, please.
Yep. Okay. This is being recorded, so.
Yeah.
Oh, that's funny. Yeah, how do you recover from this? I think at the end of the day, I think where we are was really just to try and have a conversation around what are the things that matter to you, right? And clearly mindset and how we go into this matters a lot, but I bet you there's other things that are really high on your list in terms of what are the things that really matter in your day-to-day, and how you either view the investments that you evaluate, or in your case, how you build out your coach, Eugene. And maybe we start with Eugene and then go to Mary.
Sure. I mean, look, if nothing else, all day is. I remember my girls were asking. So I'm going to abstract it from your coach, because to me, whether you're building a business, you're building,
totally.
A product, etc. At the end of the day, and I know some of the audience, it on one side it's like a cliche statement, but I truly believe that it's literally all about people, right? And I know my strengths as a leader, but I also know my gaps, right? And so anytime you're building a team, you want to get people that are better than you in spots that you're looking in the back mirror on, right? Like, oh crap, I could have done it that way. So realistically, I mean, all day long, and kind of going back to, I remember one day, my girls, who are now 18 and 19, when I was still a bear, they asked me a question like, so Dad, like, we're traveling quite a lot, you're spending time with so many people, this and that, what is it that you actually do, right? And to a certain extent, my answer was, I'm my team's psychiatrist, right? It's ensuring that how are they moving along, what's happening throughout the day, how I can be the most effective in that daily operation. So that's kind of, I think, number one. And whether, again, I'm not going to rewind all the way back, but to the bear or now your coach, we very much focus on building the team, which we're, I mean, just within a year and a half, we grew from Marina and I and Dan and one or two developers. We're almost a team of 20 now, right? Which is just crazy. And the other aspect, just, I'm going to touch on the team because we very much believe into making quick decisions, especially if the person does not fit a team, right? It just, you kind of know it. And so one of the rules that we started to apply, and honestly, I started doing that a couple of years back, is yes equals a yes, no is a no, maybe is a no. You got to move at 1,000,000 miles a minute. And if there's a hesitation on a maybe, then it's a no. And by the way, we actually, two people that came in this last year and a half, they were also gone within 2 weeks. So because actually when Marina, myself, and Dan were discussing bringing them on, there was a little bit of a maybe. There was not a unanimous yes. And so that's kind of, I think, from a people perspective, right? And maybe I'll just pause here and hand it off to Mary, because I can keep talking about the rest of the daily stuff. But I just wanted to focus on the people and the culture.
Okay, well, as I reflect on a good day versus an average or mediocre day, the two things that I remember or value are, number one, that I spent time well with, again, it's mostly people, and felt like I added value. Again, in this investing world, you may see 50 companies to find one you invest in. But what about the other 49 that you interact with? There's almost always something you can do for everybody, even if it's give them a name of somebody else to call. So I guess that's important to me. And the second one is, I also recognize that there's some people and some dynamic that I do better with than others. And I'm trying to be very clear about that. And again, very quickly assess whether or not I would continue on, even just in an advisory role. Because there's some people and ideas that just don't resonate. Doesn't mean they're bad. It's just that I'm not excited. The things that I tend to invest in and that we invest in, we really get excited about them. They're the kind of thing that at night, having a drink with somebody, they ask about the day. I can't wait to tell them about this idea. Versus others that you say, that'll make money. It just doesn't interest me.
That's spot on.
So I'd say those are the two things that I reflect on at the end of the day.
I think at the end of the day, what I'm hearing both of you talk about is essentially excitement and people. And I think no matter how our rules are and how we engage, it comes down to people, and then how much purpose and passion we put into something, because it sort of ignites something at a much deeper level, right? And I see we've been joined by Chris, my PayPal. You used to be my JPal. So Chris, do you want to introduce yourself?
Sure. Once a JPal, always a JPal, I guess, Mette. But no, thanks for pulling me up to the stage. I don't have much context around the topic here of discussion, but it sounds like it's startup struggles, venture, and maybe venture financing angle. I might be able to bring on that. But I'm the global head of digital investments for Sanofi Ventures, specializing, really in digital health and data science across the enterprise. So really finding, really exciting, transformational, early stage innovations to invest in. And, we take a long view approach to how we invest. It's typically a tip of the spear approach. So we try to think of Sanofi Ventures as the on-ramp to innovation for Sanofi. We typically think about investing when it's either too early or too risky to partner, or for the company to become a customer. And if we can find ways to get at the board of exciting, transformational opportunities, technologies, things that we can really shape together, those are the kinds of things. In the spirit of excitement, I heard someone talk about sort of the passion and the conviction, and that's really where we live and breathe. We look for things that have real exponential potential. But I think getting in early and finding ways to shape that together typically are the ones that are the most exciting to us. Happy to talk more about some of the work we're doing.
Well, so I brought Chris up because this is the reunion of the notorious TBG, three bald guys. And a commonality, talking to Startup Struggle, back in 2008, Chris DeLuca started, I think it was Ultralight Startups, and Eugene started another meetup group. They were all three meetup groups called New York Health Tech Organization, which eventually morphed into MedStarter. And I started another one, which wasn't nearly as successful as Eugene's, called, I think it was Help for Headaches, about neurology. But so we all struggled in those days, and they made it. I don't know what I've done, but they made it, and that's awesome. So it's just good to be with you. And this is the Inspa hire, right? I mean, so Eugene inspired me to Inspa hired me to take over the meetup group, which grew a lot. And I pitched at Chris's event for another startup I was working on. And, it's a struggle. And, we can tell stories about these things all day, but we also like to have fun, hence the notorious part. So, okay, I will shut up and get it.
I'm glad you remember the TBG part. I was, as I saw Chris come on, I could not remember what you called it. So, Chris, good to meet you.
I make a lot of stuff up. So... Yeah,
true.
We were all at a conference one day up at Columbia, and all three of us were together, and I got a shot of the three of us. And I'll see if I can find it.
Well, Alex, thanks for keeping the medical technology, sort of MedStarter healthcare innovation community alive on Clubroom. I feel confident that anytime I tune in, I can find an interesting conversation to participate in, thanks to the work you're doing. So appreciate it.
Appreciate your appreciation. So, we do these 20 to 40 times a week, and this is one of our favorite shows. So I'm going to shut up and get out of the way because this conversation is off topic. So,
Mette, I know you're driving this, but maybe since we have Chris on, one of the things, and I'm sort of rewinding back probably about, definitely pre-COVID, was a dinner in New York, and we started talking about how is this startup doing, whatever the question was. And the answer was, well, good, they raised this much, right? And then, how about this startup? Oh, they raised this much. And so I had this aha moment at the time around, entrepreneurship and persistence and growing. And to me, it was always this discussion on valuation versus the value you provide, right, to the community, to the stakeholders, to the end consumers or patients, right? And this was, I guess now 3 years ago. This was, I think, after Frontiers conference at some point. So way pre-COVID, way before these, every week a check for 100 million on, 3-4 million in revenues. I won't mention any names. I'm curious, if you guys want to chat about this, right? So, valuation versus value and the thoughts on it from Chris, Mette, Mary, Alex. Sorry to turn it on you, Mette.
No, it's a very preempt place to head. I don't know, Mary. Do you want to go first?
Sure. You sometimes wonder, are they correlated? We presume that money somehow differentiates and determines value. And I guess in the short term, when there's nothing else that you can value or measure, I think that's why people go there. The hard part is knowing Is this a short-term phenomenon or a long-term phenomenon? Because a lot of things have value, but it's hard, especially in healthcare. I always say to people, if you want to make money, don't invest in healthcare. If you have a mission and a money purpose, then come on in. Because most healthcare investments do not demonstrate value for a few years, and yet we keep investing in them because we see the opportunity, and eventually value and money do coincide.
I think you're completely aligned with where I am. Like I, a serial entrepreneur, sold my first company 20 years ago, and I always say if there's one place that I didn't want to land up in, it was healthcare, because I feel like every time you think you understand the space, a new thing comes in. And of course, in the beginning, it's very benign things like HIPAA and so on. But then all of a sudden, it becomes the FDA, it becomes the regulatory aspect of reimbursements. There's always some more red tape that you didn't know you were going to be encountering. And so as an entrepreneur, patience is not a strong suit of ours. So we are sort of stumbling a little bit at the fact that it takes so long. But at the same time, I think many companies that are started in this space are started from a point of purpose, right? I was sick for 20 years. I built a company where we can ensure that this does not happen to others. And to be fair, it doesn't really matter whether it's going to be a success this year or if it's going to take a couple of more years, because every single day we take more people through, we validate it further. I think we're up to 67 autoimmune diseases that we've successfully worked with to date. And we'll just keep sort of chipping at it. But that's what it is. And what's the value? You know, to be fair, our valuation is probably too high for what we are today, but that's for a future value, right? So it is a very hard question to answer, and I think everybody will have different sort of ways of looking at it. But I don't know, Chris, you are both an exciting person and somebody I trust. What are your thoughts on this?
Well, I mean, this is very interesting. I mean, it's the models are always wrong. Okay, so if we all
100%.
if we accept that, first in getting the value, the value or valuation model, we know it's going to be wrong. So we try to come up with these, formulas that give us some sense of, repeatability that tell a story. I think when I'm sitting around the table with or virtual table these days with my biotech colleagues who are investors, they are always surprised when I tell them there's a company that's generating revenue, because in tech, we have, often the luxury of having, just getting time to market, commercial proximity is always much more near term, usually. So we'll see, revenue, and then that's some piece of the puzzle that my biotech colleagues don't have the luxury of seeing. So when you look at the analogies of biotech investing, they're just, all of the modeling of valuation is really based on a series of questions that we need to find the answers to, and so that could consist of a number of experiments that need to be done. That could be a number of stages of progress in the company, and as you sort of pass these toll gates from phase 1 to phase 2, and you start to increase the credibility of the data, you start to create validation, you start to get closer to the clinic, then valuation and being able to sort of start to do some of the market sizing and sort of that's how the formula is developed and forecasted when there is no revenue at hand, when you're it's all lab work. In our world it's a little trickier or easier, depending on how you're looking at it. I think the valuation and value are also tied to a set of parameters that are similar to other industries. You're going to look at who are the other people around the table, who is the executive team, is this company, have they been able to recruit and retain the top talent? Then you look at the sort of technology differentiation. So it's going to be multi-dimensional, but then you're also going to be looking at their ability to grow and scale in different ways that continue to create that moat around the organization. So as one starts to create a distance from the competitors, valuation is based on this, like I said, this wrong forecast that's coming up. But you're starting to see that this company is similar to that company, but now they've added this, so now it's similar to the other company. And as you start to look at it, all of the organizations are like sort of, there are many health innovation, let's call them hubs, that are really helpful in sort of reporting on venture capital investments, or even doing like the market maps, and you'll see like CB Insights and all this. They're sort of organizing the categories of the companies in different buckets, and you can say, okay, these are the companies that are in like the AI space, and whatever that means, or these are all the digital therapeutics companies. And as they start to get classed, then there's, you know, there are a market sizing, you know, valuations that are put around these buckets that say, all right, this is the space. But then as soon as one of those companies in that area starts to also add telemedicine, and then they add remote patient monitoring, and then they have data science to it, you're like, wait a minute, this is a unicorn now, because they've now combined things that, so there's a you know, there's a naivety in the market that says, well, if, you know, how do we come up with formulas for the kinds of companies that don't exist? And so you start to combine different features and different factors that say, well, at the end of the day, this company has, you know, has done this so far. They have a track record. They do have some revenue. They're showing that, you know, from this pipeline and from doing the, you know, the diligence on these companies, that these are the ones that are starting to, you know, demonstrate the cream rising here. And that's how you get to these, you know, nonsensical in many cases, or astronomical price tags that say, well, you know, wow, this company is worth what? Like, and based on what revenue, and based on, but, you know, at the end of the day, you know, that formula was sort of backed into based on the non-linear, you know, calculation that I just gave the example of. So there's a lot of this, there's a lot of that. Then I go back to basics, you know, as a sort of, you know, responsible, I try to call myself, you know, venture investor. For me, I think of it as a small business. So I try not to get caught up in the hype. I have to take that into consideration because I'm around the table with co-investors. I have to recognize, you know, the ambitions of the company, and we're betting on things that, you know, that's the nature of the early risk, you know, stage here. But at the same time, you know, there's a small business that's being built, and what does that look like, and how do we make sure that, you know, we're building something that, you know, is creating value that people do want to pay for, that, you know, people are, you know, improving their either healthcare so far, or there are studies that give reason to believe that there's a road to an approval somewhere. So, you know, really thinking of, I think you have to come at it from all those angles. You can't say we're only going to look at the ones that do, you know, that run this way, or we're not going to, you know, pay attention to the ones that have hype. You really have to sort of consider all of these different pieces, and then decide, you know, for me as an investor, I have to decide what kind of investor I want to be. Do I want to be in you know, one that chases headlines and follows the hype and be part of the, you know, you know, either excitement or the problem or the proliferation of that? Or do I want to be an investor that builds great companies, that, you know, has healthy valuations, that capitalize the company towards building a storyline, as I mentioned earlier, that allows it to be able to be successful, and one day, you know, hit a public offering, or, you know, be acquired by a company, or stand on its own 2 feet, as a large scale organization that grew at the right rate for the right time for the right moment. So sorry for the long-winded, you know, thoughts there, but I think valuation is just such a tricky concept, and hopefully that gives a little bit of perspective of, it's not my exact formula, but just like thoughts around the space and how non-specific it really is when you're coming up with these pieces.
No, and I think Chris, you hit on something that all of us sort of are aware of, which is that there is no formula. It is similarly to how you have to figure out what kind of investor you want to be. We all, as companies, have to figure out what kind of company do we want to be, because every single conversation you have with an investor will give you another direction, right? You know, every time, like in our case, you know, we're going after all of autoimmunity. I cannot tell you how many investors have told me to go after, you know, just RA or just lupus or just this or just that or whatever, because they don't like the complexity of what we are trying to do. But then on the other hand, most of the customers that we talk to, they love the idea that we can actually take on all of it, right? So every single day we could sweep up, you know, sort of different directions. And I think, Eugene, you sort of alluded to it earlier, but really figuring out what's our ground, like what is it that we want to do as a company, stick to it, and then find believers. So similar to the excitement Mary talked about earlier, find the people who get excited about the exact thing that you want to do, and then sort of like get the marriage of it.
You know,
Can I just ask you
so I think
to PTR to see that notorious TBG picture. Okay.
There it is. There it is. So I think Mette, you mentioned sort of finding who you are and the leadership team and what the passion is, and I just finished off, which we had Melinda from Miami as well on this DTX podcast, and post that I've been participating in some of these sort of around digital therapeutics, and Chris may want to weigh in on this kind of later. But I'll take kind of the two extremes, and people have been asking like, okay, what's the right way to go to market with a digital therapeutic? Is it prescription? Is it direct to consumer? Is it through employer? And my answer is yes. Right? So if you take like I don't know, I'll pick the next Healy as an example. Video game that can be prescribed, right? And Endeavor got approved, FDA approved. They're hacking away at the distribution, obviously. But then you take somebody like Peter Hames that said, you know what, I'm going to go direct to consumer and move to employer market. So it's a little bit around the same concept of what is the valuation. There's no right answer. And same kind of the entrepreneurial struggles of picking a channel, right? Well, you just got to have a conviction and hack away. And as I sort of call the 5 Ps, it's persistence, 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 right?
Eugene, I love that, and I think the way you described it is so true, and I think it just represents, Mette, the way you described like going after what you know and what you stand for. I think that's what I've always admired about you, and your own story of how you whipped out the spreadsheet and just started hacking your own your own problems that were in front of you, and you figured it out yourself on what mattered and what was sort of on the table, and that's where the genesis of building your company came from. And I was always admiring how you scaled and built and sort of automated based on that route. And seem like the stories you're talking about here, Eugene. I mean, you've got these entrepreneurs who are saying, I'm going to go this way and I'm going to go that way, and they're going to try one direction or the other. It's also very disease specific, right? So if it's something that's going to be approved, or they're going to try to, if it's going to be prescription, well, it depends on the claims that you want to associate it with. I'm on the board of Click Therapeutics. Clicatine is a, over the counter, if you want to call it this, direct smoking cessation, one of their main programs, smoking cessation programs. And they made a very conscious decision to make that available through employers. But that doesn't mean that's the only channel. I think what that has allowed is for the company to scale and learn things along the way. And there's constantly left turns and right turns and uphills and downhills. And that's not the only track. The company as a platform, believes in building the right, when it makes sense to be prescription based on what what's associated and what are the circumstances, and is this standalone? Is this a hybrid? Is this combination? There are so many factors that still need to be figured out, but I think at the same time as you take these roads and deciding how you're going to get this approved, and what are the endpoints that you're going to associate it with in order to prove efficacy and create this mechanism of action. I think the companies that that double down and say, I really believe in this area, we have the right content partners, we have the right commercialization partners, or saying, hey, the partners in this case aren't going to get us there any faster. We're going to take this all the way for ourselves, as opposed to trying to figure it all out with large partnerships around the table. So I've seen companies, not Click specifically, I've seen other companies say, hey, we're actually going to bring to market this specific prescription digital therapeutic on our own because we think it matters and it needs to exist, and we're going to commercialize it ourselves, and we'll see what happens. But that's one approach. Others have taken a partner specific, partner or to build it as you partner road, and that's just a different strategy for the company. And we'll see how these all play out. But sticking to your guns and you're going with what you believe in is obviously the key thing.
Chris, by the way, I don't know if you even know this, but Clicatine is actually, we're trialing this out with our network of health coaches to be not prescribed but health scribed if an employee wants to quit smoking. So I don't know if you knew this, but Clicatine is in our toolbox for our health coaches.
Wonderful. That's great to hear. That's awesome. Congrats.
I'm sort of thinking about what are some of the things that if I was in the audience listening to us talk about valuation versus value, what would be some of the questions I had? I don't know if there's anyone in the audience that want to chime in. Otherwise, we can ponder on what would be the most helpful for you guys. I guess Maria has a question as to how this sort of makes sense to you.
Yes, hi, it's Marla. I had a question about I think when Mary Jo, when you were talking about listening to different people and the pitches, when it has to click with you, how do you deal with pitches and trying to make sure that you're not missing the next biggest thing when you're actually trying to invest? And anybody on the panel can answer this question. But how, when you're listening to pitches and you're thinking, okay, this may be the next biggest thing, or this, this may be the next Apple. How do you go about a way to make sure that you're not missing that as an investor? I'll.
What a good question. I have missed some, and I'll tell you that there's nothing like following companies that you don't invest in, and 3 years later they're just booming, and it's very humbling. But at the end of the day, and I'll give one quick example based on some of the comments previously made. I invested in a company, it's been 7 or 8 years ago, and they right out of the gate they were doing really well, and I was ready to put more money into it, and then all of a sudden one of their major competitors brought a lawsuit against them, and that was their way of getting them out of the business. So we all had to ante up to stay in and so on. Anyway, long story short, that experience was so good because I realized the only reason that company survived was the CEO. I mean, he had a great team, but he hung in there through unbelievable challenges. So the reason I use that is, and then we ended up selling it to a major company and everybody was happy and life went on. But what was interesting to me was that the product was a good product. I wasn't, ecstatic about it, but I thought it's a good, solid product and there was a need for it. But what I really learned was spend 80% of your time with the CEO and 20% on the product, because in early stage from seed, pre-seed, all the way through A, it's who's driving it, the one or two founders. I mean, someone's already mentioned persistence. You just got to hang in there because there's 80 reasons why you should give up. So now I've just learned that I really, really, really spend time with the CEOs or the founders, and I'll bet on them, and the product makes sense. But again, at the end of the day, by the time it pivots, it's going to look different. But if they are the entrepreneurs I think they are, then I'll put money on them. And again, I've been wrong, but that's where I spend time.
Can I check on this one real quick? So first, the housekeeping thing. Just everybody that you're on stage, please be advised that we're recording this conversation. We're going to publish this on medstutter.tv as we usually do. So if you don't want anything that you've said, just make sure you tell me later to take it out. And that particularly goes for you, Chris, since we didn't do this already. So if you're okay with that, please stay on the stage. If you're not, then you might want to leave. And the other thing is that I think the way to vet the startups and to not miss, and we've missed more than anybody, is to ask patients, doctors, healthcare leaders like the ones you see on the stage, what they think of them. So we use wisdom of crowds and its thing. And if you PTR, you can see that I actually not only like their vision, but I actually stole the glasses of a patient activist at our last event, Sandra Washington. She's down in the audience. So these are her glasses. I think they're pretty cool. Anyway, that's it. That's all I got to say.
Can I just add one more thing? So first of all, I thought the rule of thumb is no FOMO, right? You can't have a fear of missing out. You just got to go with your passion and conviction. But I just wanted to add, and to Marla's question a bit, just sort of, I don't know if it's been out there or not, but I look at it very much as like 4 T's, right? And so I'm putting my old kind of investor hat on, right? It's 4 T's. It's team, which I think Mary talked about. especially the earlier stages, it's absolutely back to this 5 Ps and persistence, right? Then I look at it as TAM, and by the way, not just only total addressable market from the value perspective, but what value will it provide to the end consumers as well. Tech, and I don't mean pure technology, but any kind of USP. That's kind of the third part. And then fourth is the traction, right? So those are the 4 Ts, and you do your best. But I think, again, in the earliest stages, it's really about the team and less about the product, right? The team and the market.
I think one of the things that might be maybe a unique perspective coming at it from a strategic investor lens is, we look at it from how it's not always about the returns when Sanofi is making an investment, but we're really looking at it as, how can we take a company that, we also share the belief in, and, take this to, bigger and greater places, to bring that innovation to people everywhere. And so using the scale that Sanofi can bring, and that's often, trajectory altering. Just our involvement in the company can turn into a large, partnership, can turn into a large deployment, can turn into, sort of a larger evaluation as we talk about that. So we tend to think about it from another 4 corners, which are very similar to what's been mentioned. But we begin with conviction around transformational innovation. So we're not looking for things that, would be incremental, or that's just slightly, move the needle, or to say it a little bit of a better mousetrap. We're looking for different ways of catching the mouse, or teaming up with the mouse altogether. So it's really taking a broader lens and a longer view lens to the potential of this, which is going to bring more risk, of course. Second is team. It's been mentioned, but we're really, betting on the team. That team aspect is even more important from a corporate venture perspective, because those CEOs, those leadership members can really influence how an internal organization, putting a CEO on the table, at the table with some of our internal leaders, can really shape how we think about a space and how we're tackling problems. And so just that thought partnership, once investing and partnering with an organization. The third is going to be strategic fit. So there could be great things. It could be the next big Apple. Or Apple, and it's just we can't imagine a role for Sanofi to play in that. So those would be some of the regrettable losses. But we have the luxury of dreaming and saying it's not bang on strategy today, but can we imagine? Is it sort of within reach, or is it adjacent enough to sort of steer things in that direction? And lastly, it has to make good venture sense. So we can't be making investments just if it's a great team, on strategy, transformational potential, and then the numbers don't line up back to crazy valuations, and pricing. So we'd want to make sure that what we're investing in just is good math, and the teams are amazing. The potential is transformative, and and there's some role that expertise from a company like Sanofi can play in increasing the probability of success. So just a little bit of a different twist, but very similar to what's been said.
No, thank you, Chris, for sharing that. And I think all of us are sort of like trying to figure out what are the corners of our box, right? And also making sure that it doesn't become a soapbox. So, Omar Tao, you had a question?
Yeah, good day, everyone. My name is Omar Tao, and my question is, I've been following healthcare podcasts and discussions, and I keep hearing digital health technology. Do you still look at consumer products? Because I come from the angle, I started with tech at a point, a platform, but along the way I decided to develop the consumer product end of it, and the traction from that was very, very massive. And it was quite interesting that, we're able to hit some very good numbers from the onset. So I haven't really heard, any discussions about consumer products in the healthcare sector. And then number two, coming from a non-professional, not being certified, does that have any cause for concern for an investor? What are you going to be looking at that? Because Okay, can I give a little bit of my story so you understand where I'm coming from? Now, I started this hair care product.
Matao, just for the sake, we only have 5 minutes left. So
Oh,
if
sorry
you
about
could
that.
give us like a very brief sort of, you have a consumer product and you're sort of trying to figure out if when we are talking about digital health that we're also including these consumer products, or
Absolutely.
once again,
Yeah, please go ahead.
okay, what is your actual product?
Okay, well, the products we have are products for diabetes and high blood pressure and some for men's health, and interestingly, we market them as dietary supplements, but they've been showing very strong potential of being curative more than just for management and support. So,
Okay.
that's one reason why we're looking to expand into the markets in the US and the UK, because we've been having requests from, you know, different countries in the world from via social media, our social media pages. So, but
Okay.
now
So,
yeah, please go ahead.
yeah, so I think, Mary and Eugene, I think there is probably a way for us to at least try and handle this question. I think generally anything that gains a lot of consumer traction tends to be the winner in any market,
Okay.
because the reality is that no matter how much we love the solutions that we build that create, you know, quality of life improvements, value-based improvements and stuff, at the end of the day, I think consumer will own healthcare. That being said, if you have a supplement, there's no way that you can say a sentence like curative without having an FDA approval. So from my
Yeah.
perspective, it really depends highly on how you're going to be entering the market. If you're going to come in as a wellness product, or if you're going to come in and try and be more than that. I think the reason that here we are talking mostly about digital health is because it's a large part of the VC route. Is you go from a service business of, let's say, 30% in services and 70% margin in a SaaS business, right? So that's where a lot of VCs are putting their money. But that's not to say that consumers don't come in. But Mary, you are much more advanced in this than I am, so maybe you can try.
Well, you've got examples of apps like Calm that has been able to raise $400 million. So there's obviously opportunity. The consumer is getting more and more and more sophisticated and demanding individual care, personalized medicine, and so on. The reason, though, that you don't see as many consumer products as you do B2B in healthcare is, again, because of complexity. Soon as you, I think, Mette, you said it well, soon as you really are prescriptive, not descriptive, then you enter a whole new arena, and there the complexity starts going up exponentially. So if you're a descriptive tool, a WebMD providing information, that's one thing. If you are a prescriptive tool that actually is, say in diabetes, suggesting certain medications, certain activities, certain measures of vulnerability, as soon as you get into those, yes, the complexity starts getting in the way.
I hear you. And I think maybe, Eugene, you can sort of wrap up this hour by giving us a little bit of an understanding of how you've navigated, because I think what you guys have done is brilliant in the sense that you sort of came in and became, and I'm going to botch this, but you sort of became a bridge builder, which I think between a lot of the different players in the space was really needed, and a great placement.
It's amazing because we're just doing our next deck, and one of the key slides is the bridge, and actually, talking about the wellness market and the healthcare market, and with our focus on health coaches, the health coaches, I think, for the first time ever, even though the profession has been there for probably about 20 years, are actually sort of bridging that gap, and it's your coach is certainly in the middle of it by providing health coaches, the gig economy of health coaches that are practicing out there, a platform to run their business. But then a key component of that is, on top of that, is community that they can share, for lack of a term, cases. But also, we're now understanding what these coaches excel at and who at an N=1 level they can help on the other side. Having said that, a lot of that has been driven by, and kind of shout out to the National Board of Health and Wellness Coaching that's been working with the AMA. There are now level 3 CPT codes as of late 2019, so they're not reimbursable yet, but they're out for testing. Just this year alone, the new taxonomy code for health coaches came in, and so there is that bridge. I love how you said it, Matt. Bridging what in many cases have been thought about, this cuckoo voodoo science of wellness, right? And the hard and rigorous healthcare methodologies. And health coaches, we're looking at them as the bridge to connect the two and help individuals at a very holistic level, because there are comorbidities. We want to help the pre-chronic, right? Because we're all pre-chronic at some point. And that's us in a nutshell.
Super, super excited to have this conversation. I feel like there's so many things that we could talk about, and we sort of landed on valuation and value as the main thing for today. But I think that we could both have you, Mary Jo, and you, Eugene, come back and talk about other sides of your business, right? But since we always love to hear what people's superpower is, I think we'll do a firing round here at the end and say what's your superpower, and I'll let you go first, Eugene.
Actually, to be able to go step back to the balcony, right? Because it's super important. And Marina always says, like, how do you just step back for a very short period of time when you're at the heat of this, right? And so I actually find it that sometimes taking a very deep breath, stepping back to the balcony, and in those like 20, 30 seconds to do a, kind of reassessment, I actually think that's my superpower.
Awesome. Hadn't heard that before, but I like it. Mary, is there something that resonates with you as sort of like your superpower?
I suppose in reality, it's 30 years of networking, knowing people, involved with people. It's a great gift. It's an irreplaceable gift, and I value every day all the various folks I can call on or engage in various activities. So I guess it's the network of over the years.
What you probably have gotten over 30 years of networking and looking at deals is an intuitive feel. So when the question earlier was like, what are you looking for? You're looking for X, Y, or Z. At the end of the day, I could imagine at points where it's not even that clear what it is that made you go, this is it. But the gut feeling of like the accumulation of all that it's like, this is the one we're going with. Yeah.
Let's turn that into bits and bytes, Mary. Let's turn your intuition into bits and bytes and automate it. I'm kidding.
I'd love
that would be
it.
the
sleep in.
Step back on the balcony. Awesome.
Is it going to be a hardware? Is it going to be a hardware or software? Is that another?
Basically, it's going to be a helmet, because we all entrepreneurs as investors hit our heads hard, because otherwise we wouldn't be doing this.
Do I get it?
Love it.
Awesome.
Yeah,
well, both Eugene and Mary Jo, it was amazing to have you here. And Alex, thank you for butting in. And